Thank you so much. And now I'm just going to introduce the first speaker. We'll just get the slides up first of all, as well as the speaker takes it. Rianne, from reproducible to reusable. Over to you, Rianne. Thank you.
Amusingly on my slide here, amusingly on this screen, I can see Chris Bealey's talk. So actually, I'm going to give Chris's talk instead. That's fine. Is it on? I can use the roving if you prefer. Yeah.
There we go.
To be honest, is this one on? Dude. Yeah. There we go. To be honest, I am a walker, so we'll take this. The eagle-eyed among you have noticed I've actually renamed my talk. I don't know what I was thinking when I said the reproducibility crisis, the reusability crisis in healthcare analysis. I must have been feeling very dramatic that day, just looking for like clickbaity titles. And as I was trying to write the talk, it just felt a little bit ranty, and I thought, let's just put a little bit of a positive spin on this. But the underlying thought is still there, that I do think we have a bit of a reusability crisis in healthcare analysis, and this is why. So, first of all, I should say I'm new here, I'm new to the NHS. It's lovely to be here, you're all lovely people. And I went to HACCR in July, and July is, HACCR is the Healthcare Analytics Conference, and I had a really, really good time, because there were some people doing some really, really great work. I had all these different interesting topics across healthcare. And the thing that really made me smile at HACCR was people kept saying, oh, and my code's on GitHub, my code's on GitHub. And it was just so nice to see people proudly sharing, this is out, you can use it. And they were almost saying, please do come contribute. This is really, useful stuff and we want to be involved, which is great. I just thought it would be amazing if everyone knew about this work. And on the train on the way home, sort of, I guess I was sort of dozing against the train window, because it'd been quite a hectic conference, it was good. I was sort of dreaming and thinking, well, could we do this better? Like, how could we actually take this really good stuff that people are doing? Like, is there a world in which we could all sort of share and use our code in a more reusable way? And I came up with this silly code utopia, and this is sort of where I would love to get to. And it's a little bit of a big dream, but I think it's possible. Which is that we work on great open source code together, publicly, as soon as possible in the public space, but also across the system. Because the thing that I felt in HACCR was going around and saw all these great talks, and what I overheard in the coffee breaks were things like, oh, we're also working on this problem. I wish I'd known that you were doing that earlier. Or, oh, we've actually we've done this, but we've done it slightly differently. We've redone it. And it just felt like everyone was working on some really good stuff, but in slightly little pockets, and there was a missed opportunity there. So in my sort of dream scenario, this is Nina. Nina is an analyst at Isle of Wight NHS Trust. And she's learned R through NHS Community. She's an Excel by background analyst, but she's learned R and is using R within her trust to do analysis. She also loves video games, because who doesn't? And she's got a cat called Dennis. That felt important at the time. And yeah, in her work, she's been asked to model waiting times for the maternity unit. So that's her ask within her project and her teams. So if you were Nina, what would you go do as your first step? What would you do today? And what would you do in the future? And I think what would be amazing is if the first thing that Nina did was she logs on to the National Public Health Code Library and she types in waiting list models, right? She might filter for R because she's more of an R programmer, but maybe there's some Python code, some Scala code, some Stan code, some Julia. And all of these boxes are repositories, right? And maybe all of them are sort of RAPS certified. So they might have been peer-reviewed, or maybe they've got like a high litmus score that we were talking about yesterday, or good test coverage, but they've sort of been approved and RAP certified. And they're maintained by trusted organisations, and we can talk about what trust means, but maybe the ONS manage some of these, and you've got NHS England managing some of these. So we've got this huge repository of public health code. And Nina has a look around and she finds, oh, this is brilliant. We've got this repo, it's open, it's got really good test coverage. It's on CRAN, but also, sometimes we have to work in different systems, and, there's this central NHS package manager, and it's in there, so that's fine. She knows she can get it into her system, whatever that system is or that platform. And it's got loads of different collaborators. It's not just, NHS England, it's got a few trusts who've already used that package and contributed to it. Maybe some people in government, maybe people from outside it that happen to be our experts that have contributed, fixed a package, etc. And along with the actual package and the code, which is good quality, there's also a website with articles, maybe some examples, links to projects where this code has already been used in a real-world project, and synthetic data, so Nina can get started and play around with this repository. So this is great. So she's starting a project, and her team have already found this really useful bit of code she can use. Okay, so she wants to actually put this in practice now. So because she's already working within a team of data scientists at the Isle of Wight, they've already got a lovely Databricks pipeline for pre-processing the HES data for the Isle of Wight data. So she can take that raw data and pre-process it through to a nice level where she knows, right, this is going to go into my waiting list model. She can plug in that R package, but maybe she noticed there's a functionality that she needs in her model that doesn't quite work for her needs. So she makes a PR to that central repository, which is peer-reviewed by some other people. And while she's in there, she spots an edge case, something that's not quite covered by one of the tests, and so she submits a patch for that test as well. So she fixes something when she happens to see it. And also, while she's in there looking at tests, she sees this function called with seed, which she didn't know before. So she goes and looks at that, and she learns about that as well. So while she's in here, she's contributing to the model, she's making it adapt and work for her use case, she's actually fixing some stuff for other people, and she's learned something as well. And if anyone's curious and doesn't know the with seed function, the with R package is a really nice package in R for helping you sort of restore your environment after a test case. So quite often when you're doing tests, you want to make a variable or adjust something or set a parameter for your test. And it's really important to remember to tidy up after you've done that test. So what with seed does is if you have any tests which use set seed to handle randomization, with seed will restore your random number generator back to how it was before the tests. Because quite often in global packages, people will have these set seeds in their tests, and the end user doesn't realize that their randomization process is being affected by that. So it's a nice little function to know. And then obviously she's going to share this, right? She's learned something, she's done a project, she's solved waiting times. Maybe this is a little bit optimistic, I am new to the NHS. And yeah, so she cites that original package as well, because it's important to support and link back, and the data linkage work that's been done with the HES data in the pipeline. Clicking the big green button, there we go. And yet she writes about it maybe for NHSR community or somewhere else. She shares, oh, this is how we did our project. And then maybe perhaps another analyst actually reads that and goes, oh, that sounds just like my problem. We can go and use that. Okay, so thank you for bearing with me with my dream. I know it sounds a little bit hypothetical. But I would argue, well, one, this is lovely, right? Do we agree that this is a nice world, we would quite like to live in it? And I know you're all staring at me going, I've worked in the NHS for 30 years and this is not going to happen. But I do think that we are part way there, right? We're doing some really, really good stuff. So there are a really growing number of RAP projects, and people weren't using the word RAP years ago. So there are a number of really good RAP projects on GitHub. And analysts are skilling up, which is great, particularly in what I've seen over the last few years, is analysts skilling up in their confidence in writing functions, which is great, and also Git. I think people are a lot more Git literate and Git savvy in the last few years, which is nice to see. I've come across a lot of teams who are using repository templates, which is really nice. So repository templates are ways of setting up some standard files that you would want in your GitHub or your GitLab repository. So there might be things like README, gitignore to make sure that you don't accidentally commit secrets, and configuration files, etc. Code owner files, license files. And also useful functions are being shared, but often in sort of in repositories rather than a more shareable way. So this is useful and good. So quite often you'll see teams say, we've got this template repository and it's got code owners and it's got license and it's got README. And it's also got a little folder with a bunch of helpful files, which might be called helper.py or utilities.r. And they might have functions like, this is how we access our API or our data pipeline from internally, or this is how we write to Excel files within our organization. So there are really useful functions being sort of shared internally, although I think we can do that bit a little bit better. And there are some really good collaborative projects like across the system happening, especially with the NHSR community as well. I'm thinking of things like waiting list or plot the dots. But I do think that there is another step we can go. And I think in order to make that next step, we need to stop thinking about reproducible analytical pipelines and think about reusable analytical pipelines. And I think that bit is actually really quite crucial. So going from reusability to reproducible to reusable. So this is a table from the Turing Way, which I've slightly adapted, because the bottom right corner they call generalizable, but I think the principle applies. We get excited about reproducible, and reproducibility is great, right? We want to be able to run the same analysis on our same data and get the same results. It's really important for openness and transparency, and just being able to sort of trust the analysis that we're running. But if we want to be able to work across the system, and I guess the point is to be able to make code which, ideally we want to be writing less code which is really high quality, which we can maintain and put effort into maintaining, rather than writing lots and lots of code individually, and then that's obviously more challenging to maintain, isn't it? So ideally it would be nice to move from that reproducibility square to reusability. So this is something that I've been thinking about for a while, and it feels important, but again, I'm new here, what the heck do I know? So, I mean, I didn't go out and do a big full study and collect data. I did what any good data scientist would do and wrote some BS on LinkedIn and said, hi, come talk to me. And had some really nice conversations with some people following that. So I think reusability is crucial and perhaps the most important bit of RAP. This one I liked. Reproducibility, or reproducible, generally falls on the covering your backside things for me. And I think that we sometimes feel that, don't we, when we're creating code, we want to be able to, oh, what if someone looks at it? We want to be able to prove that it did what it did yesterday. And it's more about let's protect ourselves rather than how can we use this elsewhere. Maybe RAP should be RAP. Yeah, very catchy. So yeah, let's get this reproducible, reusable and replicable bit as well, because this bit is important. Reduce, reuse, recycle. I really like this one. I think we should start pushing this. Works well in the context. So the idea is we reduce where we can, and it's not possible in all cases, obviously, but where we can, reduce reinventing the wheel. Reuse other people's code where we can, and recycle code. Or just let other people use it. This was an interesting point. Reusing code is a bit of a psychological shift. When you write something yourself, you know where each step came from and how it fits into what you're trying to do. So there's a kind of a trust element there, right? You know, I know that my code is trustworthy, and I followed it through, and I know it works for my case because I've written it, and you know I know what I'm doing. Well, if you're working with code that someone else has sent you, you spend a lot of time trying to work out either what they've done or does it work for me? Like, can I adapt it for my case? But we do this all the time, right? When you install dplyr and use the functions, you didn't write that, but you trust it and you know how it's usable. But I think it is a bit of a psychological shift. And then this is another really important point, like we're busy, yeah? We're in a resource-constrained world, and some of these things are in direct conflict. So do we really focus on making sure things are replicable and sort of covering that backtrack, or do we sacrifice some of that time and try and make it reusable so that other teams can use it and work from it? And this is, I think, the really hardest point, actually. It's knowing what's out there. I don't know what code has been developed in my team, never mind across different organisations. And this reminds me of, so I didn't say earlier, I work at the strategy unit, and I was doing some work the other day where we were connecting up to one of our APIs, and it was a fairly simple script. I spent an hour on it or something and wrote it and put it into the repo, and I was about to get Matt to go and code review it, and then I realised he's written exactly the same thing 4 months ago. I've basically done it, and we're a team of 5, 6 people, and I hadn't realised that Matt had done exactly the same thing I'd done a few months ago, and it was only a small project, small script, it wasn't a problem, but it's really hard to know what other people have done. I think the big challenge is the NHS is not one organisation, and I think if you think of it as that, it's easy to think, oh, well, surely we can just all share everything, but that does make things really difficult. I think there's also a little bit of a hesitancy in developing in public. You know, the putting it out there is fine, but that process of this isn't quite finished yet, and I'm kind of working it out, and I'm going to have to put all of these issues out there and have all these public discussions. And I think there's a bit of discomfort in there, which means it's harder for people to see what's happening. Sometimes we do think just about our little problem, and obviously our problem's really important, but it's nice to have an awareness of what's around. And just discoverability. How do I find what someone else is working on? If I can really describe my problem well, how can I go find it elsewhere? And then one of the other challenges, I think, is we've got, like I said, analysts are getting really, really comfortable at functions and Git. But I think there's sometimes a bit of a nervousness about learning to make an R package or a Python package. And actually, making a package isn't too scary. It's actually it's nice, a user-friendly way to get involved in doing like software development, and it's quite fun as well. But I think people are perhaps a little bit nervous about starting with package development. And if you are in this box and you're interested in doing package development, do come talk to me, because I promise it's really easy and there's lots of ways to get you started, and it's really good fun. And yeah, infrastructure, but let's not talk about that here. And resource. So there's lots of challenges. By the way, there's no solutions in this. If you're waiting for me to like give you the big answer at the end, oops. No, there are some things we can do. In my head, there are 3 things we can do. Build more modular code. And that's easier than said than done. Thinking big picture is tricky because you don't want to think too big picture too early. You don't want to be thinking of, how are all of the other trusts going to use this one bit of code right from the start? Because frankly, it's overwhelming, and also you might build the wrong thing because things change, right? So I'm not saying we need to think big picture all of the time, but it's nice to have in the back of your mind sometimes, what if someone wanted to adapt this, or would this be able to connect with another service? Not in a way that drives the development, but it's just nice to have in mind. The smaller, more modular functions is a learning process and something that you keep developing. It's even simple things like if you're building a function that creates plots for lots and lots of different trusts, having that plotting function separate to that generate all of the functions just makes everything a little bit more reusable, and someone can go and use that little snippet of your code. So more modular functions do really help. Packages I do think will help if we can get more comfortable building packages and just putting stuff out there. And writing for humans as well, because obviously someone else has got to pick up your code and know how to use it to be able to adapt. So building more modular code is one way we can do this better, I think. And the second thing is just shouting about it. So I talked about this idea of like a national code library earlier, and that is a bit of a nice hypothetical idea. It was mentioned, it's number 19 or something, in the Goldacre review as something that would be really good. And I know that NHS England are starting work on this idea of a national code library. It's taking a bit of poking, but they would like to get there with a national code library, which would be great. But yeah, the hard thing is getting your code out there. So one thing is you just write about it and speak about it as much as you can. And obviously you guys are already convinced of that because you're here telling us about all of your work. Don't wait until it's finished to share if you can, right? Putting your development stuff out there means that another team might find it early enough to be able to contribute and take part. And yeah, it takes effort to find people who might be interested. I think this is the hard thing. So I was chatting to, there's a guy who does a really nice podcast called Tactics for Technical Leadership. And he says that as your teams get bigger and bigger and bigger and you're trying to get stuff to expand, you have to work really, really hard to shout about the stuff you're doing, but you also have to make quite a lot of effort to be curious about what other people are doing. You might have seen this if your team has sort of grown in size. When there's 1 or 2 of you or 5 of you, you sort of know what everyone's doing. And as you get bigger and bigger, you realise you don't know what everyone's doing. And sometimes that's fine, but if you want to find out something that someone else is working on, you had to actually be quite, proactive in asking, what are you working on? Are there stuff? You have to kind of hunt it down as teams get bigger, which is hard but important. And finally, I think we should be rewarding reusability more. So there's a little bit of a shame sometimes when I speak to analysts and they go, oh, well, I didn't really write that, I just stole it from Stack Overflow. Or like, oh, it's not really my code, I just borrowed someone else's code. And people sort of say it in this, oh, I didn't really, I'm not a real programmer, I just copy and paste stuff. And actually, this is where the good stuff is, right? Someone's already done something and you can take that learning and make it your own and share it. So we should be saying, yeah, I got this from Stack. I didn't write this. Why would I bother rewriting stuff? Like, I've taken this idea and done it. So I think we should try and borrow with pride a little bit more. But I think we should also, really celebrate the people that do put out there, and I think we're quite good at that, right? Because it is brilliant when you put your code out there. It's really useful. It's really appreciated. So thank you to everyone who has put a GitHub repo out there and shared their code, because it is really appreciated. But I think we should also, and this is a weird one, reward people who take that code and adapt it and make it better. Because we don't really always celebrate the people who adapt code, and I think it's kind of a lot of people who've come from academia. In academia, your work is only really valuable if it's new and it's novel and you're pushing that kind of frontier, right? It's not seen as being as valuable if you just take work and just, you reuse someone's code on, say, a different application. It's all about how do I get novelty? How do I show that my work is new? But, in terms of the context we work, taking code and making it reusable for your situation and maybe improving on it is much more valuable because we can maintain that code and put effort into managing and improving that code rather than writing the same code lots of different places. So we could do things like, rather than have who's written this, we could have a reusability contest where we actively reward groups that don't go away and just do stuff from scratch. It's who's taken existing code and actually adapted it for their use case, and that's, we reward that instead. So that's all I wanted to say about reusability. I wanted to talk about this because it feels really, really important, and I would really love to chat with people who also think this is important. So if you are interested in reusability and you think it's something we can do better and you want to chat about it, please do come chat to me. This is some really useful stuff that I found, and Undraw is where I got all of the icons from. They don't require me to cite it, but I think they're quite pretty, so... I had some really nice chats with some people, lots of people, but these were some of the people that really contributed to some of the thoughts around this, so thank you for nattering with me. And if you are interested in this more, I would love to hear either what makes this hard, why am I being stupid and thinking this is really naive, really easy. Tell me your challenges, tell me where this has gone well, and just, I'd love to chat about reusability more. So thank you very much.
I'll share the stage with you as we get the other mic sorted. There's a huge conversation going on in the Slack, so I've had to tag questions, but the conversation is amazing. Please keep it up. Sounds like a great idea, but I think lots of people have half done things that would be helpful. Do we need the library to contain only code that's perfect? There's a lot of discussion about the code library generally. So your thoughts?
I told you I have no solutions. This is what I want you guys to talk about. As in, so should there be good quality, perfect code in the code library? I don't know. It could be this is gold standard and all of these things are wrapped, or it could be that there are levels of filtering, right? And you have, this is actually a play space, this is a scrapbook, or this is a sandpit where we're working. But if you want to see stuff that's really well maintained or externally peer reviewed. So one thing that's quite hard is quality review as well in terms of our packages. And actually had a useful chat yesterday with Seb where you were saying about how our OpenSci has a really good peer review system. So if you're putting a package together for our OpenSci, they have reviewers, and a reviewer will actually go through and look through the code and the documentation, and they might spend 6 or 7 hours really working through and reviewing that code. So there could be things like that contributing to a national code library. But there might also be a space for, this is something I'm starting with, and we're not promising that it's done, and we know that it's in a space, but we're thinking about it, and that might be a place to work. So I do think there is a place for those not fully formed perfect ideas, because nothing's perfect. But it would be nice to have a kind of way to see the ones that are more maintained as well. And there are lots of different metrics we can use, in terms of our package check testing, code coverage, litmus, etc.
Brilliant. Hello? Hello?
To me, to you.
To me, to you. This mic's not back on yet. So how can we promote the cultural change needed to give practitioners the time and space needed? I'm going in and out on sound there.
I'm going to say that's way above my pay grade. I think we should talk about it, though, but I do not know how to answer that question. But I'd love to go talk about it in the unconference.
Say NHSR community. Carry on with that one. So I think that would be where we do the cultural change. Is stronger messaging enough? At what point does it need to become a statutory duty? Again, these are really deep questions, aren't they? I'll move on. That was a good one. I think this is an unconference topic. There's a lot of stuff on this. And whether it should be a national code library or we're just replicating Git. Do you have a thought on that?
Well, yeah, because I was chatting to, it's Sam Hollings at NHS England who's sort of pushing for the National Code Library at the moment, and I think the way he's thinking it might work, and I don't want to sort of speak for him, but is that it would effectively be a website that wraps over, wrap's a terrible choice of word there, isn't it? Jeez. That scans, I'm going to say wrap, over GitHub, right? So it basically will pick up repos, so it won't be replacing GitHub, it would be effectively pointing to and signposting. So a sort of framework to help us search GitHub in a more formal way. So I don't think the idea is to replace it, because we want places in one thing.
There is a shout out for an unconference topic on this, but you'll have to go.
Yeah, well, after submitting this, I did realise this is so much more an unconference topic because I know nothing, but I want to talk about it, and I think it's really important. So maybe we can put another one on later today, or if not, come back next year.
And also a shout out to those civil servants who came up with the acronym RAP. They're not here today, but I think we should also recognise that RAP is a naming convention that we've come up with, and it's been used throughout the systems. There's so much conversation, it's hard to find the questions, but I'm going to say thank you very much. Round of applause. So the next talk is from Marcus, Shift Staffing via Task Load Prediction. Just going to check on the mics. I think it's still this one. If you could stand in this area. No, it's off. Try this.
Yeah. Hello?
Ooh, yeah.
Yeah, that works. Mm-hmm. Oh, these are Chris's slides. Okay. Hi, everyone. I'm Marcus Fabietti. I'm a data scientist at Nottingham University Trust. I just thought it would be good to clarify from the start. This talk has some machine learning elements. The purpose of this talk isn't to tell you, look, this is a great machine learning exercise, so we use these very good techniques. This is how we fumbled, and these are the steps we go along the way, and this is all the corrections we have to make. So a lot of the little tweaks you have to do in these types of projects that a lot of the time in conference get overlooked. They just say, we run this perfect data set, we got this perfect results, and so with that out of the way, the first thing that came to me was an ask about tasks. People wanted to know how many tasks they're going to have in the future. Digging a bit with the stakeholders revealed that the actual question was, we need that to staff, right? So the key element, or key question was, how can we predict staffing based on that demand? With that in mind, we looked at the data and we took 2022 as the cutoff point because of COVID. That's usually nowadays what we operate with. And we looked at every task raised in a shift. So the first challenge was defining the problem. The first solution that came to mind is saying, right, you have a patient with these characteristics, you do a regression, and you target how many number of tasks they have raised. The issue with this type of regression problem is that we have an infinite number of tasks, and there are so many patient characteristics. So in that sense, when you have more targets than the regressors, the problem doesn't work. So what do we do? Outside the first one, which is the first solution, we thought about maybe two other solutions. One would be having n models, so you can either run on parallel one model for each task, which obviously computationally would be a nightmare and maintenance-wise. The other one would be something more closely to a cluster, in which we assign for each patient a cluster profile, and then at the start of each shift, we would aggregate the number of tasks that patient cluster would generally generate. At this point, we said, right, we have a few ideas, but we really need to start looking at the data before we move into the actual modeling. So then, this is what I like to call the usual suspects. This is a very basic toolkit with a bit of machine learning and just exploratory data analysis in Python. The first thing we did was take a look at who was carrying the data. Obviously, there were missing entries. There were people doing tasks they shouldn't be doing, and a lot of overlaps in categories. So what we did was work very closely with stakeholders and basically relabeled the whole data set into 5 major buckets. That was a manageable amount, and that's showcased in the table at the bottom. And similarly, we did the same with the actual stats. We had a lot that were system alerts, things that weren't relevant. Again, tasks being carried out by people that shouldn't. So after cleansing all of that, we cut down from 350 tasks all the way down to 82, and that was a bit more manageable. Going a bit through the exploratory data analysis results, we found that this is the frequency of the tasks raised throughout the day. The peak around 5 o'clock in the afternoon corresponds to the handover at the end of the shift. And looking at just a simple frequency bin, we see that drug prescribing, cannulation, clinical review are the most frequent tasks by a large margin. There's other two details of the tasks. One's grade. The grade in itself tells us about the urgency of the task, so or priority. It goes green, amber, red. What we find is that for each individual task, it's mainly has a one very strong priority. So if it's green, it's mostly green. If it's red, it's mostly red, and over 90% for all tasks. So that's quite consistent. However, when we look at the staff, again, with these new 5 buckets, we see a bit more variance. So there's still, for each task, a main staff group that does them, but then we see a little variance in a few groups, and this will be important down the line. So with this in mind, we went back to the proposed solutions. The first one, as we said, didn't make much sense regression-wise, so we moved into the clustering. So for example, we would be looking at patient-level details and then clustering the patient profiles. However, looking at the target variables, we found that most people just use junior doctors, in about 70% of them. So the other clusters would be very small and very likely to miss. So we discarded this possibility and looked for the third method, which were the end regressors. So obviously we said you have an infinite number of tasks. How do we sort this out? So the way we found it is that if we use a series of features, and then instead of the number of tasks, we said the number of each individual task would be the number of tasks carried out by each group. And do a regression based on that. Yeah. So in order to do that, the first idea was, well, we'll just assign all the tasks to the category, to the staff group that does it the most. And what that did was basically kill all the smaller buckets for the more specialized classes. So we're like, okay, what do we do now? And the solution was, well, if a staff group does it more than 50%, we'll say, good. You have that staff, you fall into that staff group. However, if there's a second staff group that does it at least another 10%, so we have anything over 50, and then it shares with another. If it's anything over 10, we created new buckets that basically look like this. So each group now is a combination of the staff groups. We have 11, but discarded 3 because there were too few examples and didn't make a lot of sense, with 99.9% in the top 8. And what this allows is not only flexibility with the forecasting, but also we can decide how we staff, right? So we can staff based on the group E, and as you can see, group E is shared among different categories. So in the forecast. So we can aggregate the demands and move staffing across buckets as we see need. And what we did now was modeling. We used a bit of XGBoost, SHAP to see feature importance, darts and profits. I'd really recommend for anyone looking at time series analysis, please use darts. It has every model, has all the metrics. It's an excellent wrapper. It'll simplifies a lot the time series analysis. So we trained an XGBoost model, a simple regression model, to try to see if we could accurately predict the number of tasks raised by each group. And with the features day of the week, day of the year, the month, the number of patients for fit for ward flag, so that's the number of people that eventually later will be creating the more tasks, the overall capacity of the hospital, so not only how many beds we have free, but also how many occupied we have, and then the number of discharges, so it's patients that will be discharged later in the day, which that signifies, well, there will be a decrease in the tasks raised, thinking that the decision of staffing will be taken at 8 a.m. in the morning. The results of SHAP indicate that day of the week was significantly more important than all of them. So my thought was, well, if today is so important, what happens when we look back? So we had a timeline, so we give the model information about the number of tasks raised from 21 days before, so each day all the way back 3 weeks. What this shows is that there's a strong case for seasonality. We're seeing that the lag on that day, the day of the week, that day, 4 days before and 11 days before, 20, are much more impactful to the model to make a decision in the prediction than, for example, how many empty beds. So this made me think, well, we need to reframe this problem, not so much as a regression problem, but as a time series problem. This is also shown, this is a simple correlation matrix where we see that in regards to the response variable y, none of the external regressors have a very strong correlation, at least linear. So that validates it. So for the time series model, we used Facebook profit model. It's a very simple model to use. Stakeholders really like this model because it's very simple to explain. It decomposes your time series into a series of seasonalities, and you can add holiday effects. That includes not only holidays themselves, but any abnormal period that could be, for example, COVID. And we can see, for example, that's a fitted model with the black points being the actual data points, the dark blue, the actual model, and then the lighter blue band would be the 80th centile. So the results, we were able to fit the model quite successfully and this is on the left, the seasonality decomposition that the model automatically does for you. So again, showcasing that there was a strong seasonality to our problem. And the results show with metrics such as mean absolute square, root mean square error, good performance, as well as normally distributed residuals. So again, good model. And what we've done is apply this thing for all 8 buckets. And the way we feed these results back to the stakeholders is the Excel report with the data definitions. That means what each bucket means, so which actual staff numbers are in each bucket, number of tasks in each one of them, and the task list, as well as the forecast of the 50th and 80th centile. So we've been validating this model over the last few months, where we've been getting okay-ish results. We're trying to improve them at the moment. However, what this model lacks is that because we have that flexibility in the buckets, even though we're under or overestimating in one bucket or the other, we can level them out depending on how we staff. And then as a conclusion, we were able to get quite a good prediction of the tasks raised. We used a historical productivity measure based on the amount of staff we had on a given day and the amount of tasks raised. And then we currently are returning the results in a spreadsheet, but we have a feedback form given to them where we're trying to see what better ways we have of giving back this information. And then, as I said before, we're trying to improve the model. Either it's with reporting a higher centile because we can't be understaffed, so overstaffed we can manage. So maybe it's just a matter of playing which level of which centile we're playing in the forecast, or just change the model altogether. For example, with an NHITS or NBEATS model, which are transformer, more complex time series model. Thank you. That's all. If you want to contact me, my email's on the screen.
Thank you. Thank you. Was there a reason you chose machine learning over something like simulation model approach like discrete event simulation?
I guess it's just the way it came naturally after the data exploration, how the problem was set up. It didn't seem to, it's a descriptive type of problem. We're not trying to test how the staffing should behave in different stress points. We're just trying to model its behavior as it is. So I guess that's why I was more inclined for machine learning.
Okay, thank you. Did you include any data relating to the health inequalities of the patients? And if not, could you?
Yes, the Prophet model, which I described earlier, you can add external regressors. So you could, for example, add details if you have a description of the cohorts that are going to come on a certain day.
Great. How trustworthy is your data set? Are all the tasks consistently electronically recorded in the place? Does
Yes.
it vary?
Yes, so depends on the field. So for example, there's quite a bit of a discussion between when tasks are finished, because a lot of the times we have nurses that, for example, finish a task physically, but then just wait till the end of the shift to annotate them. So yes, there's some data quality issues in the data set, definitely, but I think we just utilized the most reliable features we had.
There are other comments as well within the question, but from clinicians, so I think that'd be really interesting to connect with that as well. They're quite detailed, so I'm not going to read them all, but there's a lot of information, and connecting with clinicians is a really important thing.
Yes.
If your data is on task completed, is there a danger that you're predicting supply, what can be done, rather than demand? Was that a next step?
Yeah, no, that's an interesting question to look back on. Yeah.
Okay, thank you very much. Another round of applause.
Yep.
So the next speaker is Sammy, talking about unleashing the power of pathway simulation. So it follows on nicely.
Fantastic. Thank you very much, Zoe. So yeah, as Zoe says, hello, I am here to tell you why I think now is a great time to be making the most of pathway simulation in your organisations. So a little bit about me. I was in the NHS for a couple of years. I no longer am. I'm now a trainer on the HSMA programme. I'll tell you what that is in the next slide. Mainly working in Python these days, obsessed with Quarto, Streamlit simulation, maps, DataVis. If you're into any of those, do come and follow me, come and have a chat with me. Would love to link up. Now, I can't do this talk without mentioning HSMA, the Health Service Modelling Associates programme, because all of the resources I'm going to share throughout are only in existence because of that programme. We are a 15-month data science and operational research training and mentoring programme. We are supported by the NIHR and the NHS Digital Academy, but the key thing is the full programme, the training online and 9 months of project mentoring are provided free of charge to people working in health, social care and policing. We have several people on the programme in the room today. But for all of you who can't join the programme right now, we're right in the middle of one round of it. All of our training is available on our website for free. So if you're looking for training on simulation, data science, natural language processing, mapping, geographic optimization, web development, Quarto, Git, anything like that, come and have a look on our website. I'm hoping my colleague may be able to pop a link in the chat right now. So my first task is to convince you why pathway modelling might be useful to you. So I'm going to start off with a little bit of a motivator. Your emergency department is struggling. The queues are out of control. And you've gone and looked at the data and you've spoken to people around there, and you're thinking of trying a range of different things. Some people think it's the number of staff that's the problem. You could increase the number of staff that are available to register or treat or triage people. Other people don't think that's the problem. It's the number of rooms or the number of beds that's the issue. Actually, other people are saying that's not the issue at all. We've got plenty of those, but it's the rate at which the tests are being processed. People are sitting around waiting for that to happen. Other people think you can't fix the process as it happens. We need an extra step. We need to take some people off down a different pathway, something like that. And other people are telling you the whole system is broken. You need to completely redesign it from scratch. I'm not sure it's going to be very easy to tell which of these is the right answer without trying them out. And healthcare is full of queuing problems like this. It's not just emergency departments where you've got people turning up like that, it's walk-in clinics. Could be people calling telephone-based services like 111 or a mental health crisis line where you need really quick responses. It can be longer term as well, people waiting for cancer diagnosis and treatment pathways or any other disease of that kind. Maybe it's actually waits of years. People currently waiting for ADHD and autism assessments or on gender clinic lists. And it can be even more complex than that. Maybe people don't go through a kind of clearly defined pathway with 1 step, 2 steps, and so on. Maybe they're going back and forth, having one appointment, several appointments, many appointments. Overall, these systems, when we break them down, we take them into resources. So we've got our people, our equipment, our rooms, our cubicles, that sort of thing, our places. We've got our beds. Maybe we've got treatments as well. That's not an unlimited resource sometimes. Vehicles to move things around, and also the resources that are experiencing demand from some kind of entity moving through the pathway. It might be people in person, might be the people on our telephone lines, it might be the test requests passing through. But fundamentally, most pathways break down into these component parts. And as these entities are moving through a pathway, they are getting stuck where the resource doesn't match the demand that is being seen. And these pathways are really complicated. They are full of lots of moving parts. They are full of lots of variation. It might be how often people arrive, how frequently they're arriving, and when that is. There's variation in how long things take to do on the pathway. Different complexities of people might need different lengths of time with a resource. And people don't even all go through the same pathway, even within the same system. They might need an extra step. They might not even get into the pathway. They might be kicked out at an early stage. So much complexity, so much variation. And you try and make these changes that you thought might be the right one, but that is costly. It's slow before you actually know whether it works sometimes. And fundamentally, it can just be unsafe. You could make it worse. And maybe you fix that original problem, but all the knock-on effects are things you didn't foresee, and you're in a worse situation again. And assuming you avoid all those problems, your system might be coping right now. But is it going to cope all of the time? Is it going to cope on a really bad day when the demand is higher than you usually see? Where is that point? Is it going to cope if demand increases generally in the future? How can you predict that? How resilient is your system? If you are down 1 nurse, 1 doctor, 1 room, are you going to cope? It would be really nice to have a nice, safe, closed system where we can try this out. Now, on HSMA, we actually teach a couple of different computer simulation techniques. One of them is going to be the right one. We teach system dynamics. Now, this is a really quite a high-level technique. It's often very good for uncovering fundamental issues with a kind of high-level pathway, a wider healthcare system design, but it's not quite what we're looking for here. We also do agent-based simulation. Great for things like disease modelling, can also be used for lots of other things, but it's individual-level modelling that's really interested in individuals' decisions and interactions. And again, that's not quite what we're after. What I think we want is discrete event simulation. Now, this is taking our entities flowing through a pathway using resources along the way. And discrete event simulation allows us to really dig into that. So like I say, it's powerful because we have a nice computer-based reproduction of our pathway where we can make any changes we want safely and basically for free, the cost of your analyst's time to build and validate the model. And we, as the people programming this model, have complete control over whatever we want to measure. Is that weights at each step of the pathway? Is that people meeting certain targets? Is it how much of the time the resources are utilised for? Is it within safe limits? And so on. And DES is really great at dealing with that randomness that we mentioned before. So sometimes we've got a system where people turn up on average every 10 minutes, but we don't just want people turning up every 10 minutes. That's not going to work because in reality, sometimes people aren't going to turn up for half an hour. Sometimes 3 people are going to turn up simultaneously. By using distributions, by calibrating them to match the real world patterns we're seeing, we can then start to pluck samples out of that. And sometimes people will turn up with only a couple of minutes between them. Sometimes there will be a longer wait, but it will mimic the real world patterns. And that can be the same for activity times or anything else that you want to sample. And that randomness is actually great for us. We can hold those random patterns consistent, and we can start to change the resource levels or the pathway design, or we can hold the resources and pathway design consistent and allow randomness in those arrival patterns or in those activity times. The first allows us to be really sure that all of the changes we're testing are actually responsible for the differences. The second allows us to test our system effectively in multiple parallel universes. We've got multiple different times that this day has run, this week has run, this year has run, to be sure that our system is robust. And then we can start to summarise it in whatever way we want. We can summarise it across multiple runs so that we've got a nice high-level idea of, is this going to work all the time? Is this going to be safe? Or actually, we can start to dig down into the variation across runs. So in this particular case, the average utilisation of the doctors within the model run, it varied a bit, but it was always across these different days, these different patterns of arrivals and how long they needed to spend with everyone. It was always in a sort of a range we were happy with. The nurses in this particular simulation run, it was always right at 100%. You had a serious problem there, and you can start to drill down into those sorts of things. Is it sometimes in a range you're not happy with? Is it always in a range you're not happy with? And then you can very easily start to explore the impact of different scenarios. So here, all we've done is add one extra stabilisation bay to a trauma pathway, and we can see the impact it's had on different parts of the system. And there have been some knock-on effects that we can start to explore. Now, wouldn't be a good presentation on this without mentioning the standard George box quote, but your DES obviously won't be a perfect one-to-one reproduction of the pathway you're modelling. It can't be, and to be honest, it probably shouldn't be. We need to make assumptions and simplifications. We can't capture all of the complexity in these very complex pathways, but they can still be incredibly useful. Now, on the HSMA programme, DES is one of the most popular things. We've had in the past over 35 projects using it in some manner. A third of the projects this year alone are using DES as opposed to the other things we teach, and it's also really frequently used in the PenCord team, which is the research team I am technically part of. So just a couple of very brief mentions of some good outcomes from these models. We had a model that was used to support an on-the-spot rewrite of a bladder cancer pathway, and that resulted in multi-week reductions to waiting times. Links to all of these projects if you want to find out more. It's been used for COVID-19 vaccination clinics. It identified that there was a problem with the plan and was used to refine the plans to make sure that social distancing wasn't breached. We've had projects that have looked at urgent treatment centres, emergency departments, etc. There it was identified that additional rooms would solve the problem they were having with ED flow, and it went away and they redesigned their pathway as a result. It can be used for mental health assessment pathways. In this particular project, it was used to check whether allowing patients to book across a range of different sites rather than just their closest site, what impact would that have on the system overall? And it was able to show that this queue sharing would result in better waiting times across the board. And children's neurodiversity assessment pathway that was really struggling And the model showed that the extra lead clinician they were planning to recruit would not solve the problem, but an additional second assessor would. And the model could also allow you to play around with parameters to see how you could clear the backlog, the huge backlog that had built up in a reasonable time. And you can find details about our previous and current discrete event simulation projects on our newly redesigned HSMA website, where there are also links to all of our modules and some of the other resources I'm about to tell you about. So, DES Playground. This site was designed to help teach the key concepts of discrete event simulation to non-technical beginners. It uses browser-based Python, so calculations might be a bit slow if you try it out on your phone right now, but it's designed to walk you through the concepts of DES without actually taking you through the code at that point. There are drag-and-drop tools out there. There are paid ones. They are extremely prohibitively expensive for the NHS, but there is a free drag-and-drop tool called JamSim. In R, we have the Simmer package. In Python, there is Salabim and Q, but on SymPy is what we teach on the HSMA program. It's robust, it's mature, it's stable, and it's really flexible. We have extensive training on discrete event simulation in the HSMA. We take you through what DES is, how you might simplify a real-world pathway. We take you through the features of SymPy. We take you through how to write simple discrete event simulations, add in multiple steps, branch your pathways, optional steps. We take you through a load of advanced things as well, so how you can model resource unavailability, how you can use different distributions, how you can have priority-based queues, that sort of thing. All of this has already gone into a free ebook as well. So this will hopefully be a really handy reference to how you could do DES with SymPy. It's packed with code snippets, and it is also, it goes beyond the lecture content to cover things like appointment-based models and parallelization. We also find that web apps are a fantastic thing to pair with a discrete event simulation. Works really well for that. It gets the model into the hands of stakeholders and can help them with understanding and engaging with it. Streamlit is a great tool for that, and we have content both in the recorded modules and in our HSMA book of Streamlit, walking you through a range of Streamlit concepts and discrete event simulation specifically. Last couple of things. So as part of creating that DES Playground, I put together the visualization you might have noticed of some little people moving around. And it really resonated with the more non-technical people that we had, and also the technical people. It's a great debugging tool. So we wanted to make more use of it. And this has been a historical limitation of some of the FOSS code-based options, not being able to produce these simple visualizations. So very much a work in progress, going back to Rihan's talk, but the Vidigi package is out there recently. It's designed to be a flexible library for creating these animated visualizations for any simulation. And to be honest, I think you could use it for real pathway data as well if that felt like a useful use. It helps process event logs into the required format, lay out the animations, and add your icons for your resources and entities. Under the hood, it is just a Plotly scatter plot, but that means it integrates really well with all the tools you're already using, and it takes it from that plot to something like this, where you can start to keep track of the resources people are using, see where your queues are building up, and so on. You can also work with what we'd call resourceless queues. It's very, very flexible. To go along with this, I'm working on collating and visualizing models from across healthcare systems. At present, it's very much a work in progress, but we've got some theatre-based stuff, we've got some community mental health stuff, and all of that is going to be available and added to. And if you have any models that you'd like to try this out with, do get in touch. I'd love to add it there. Final thing, model reproducibility. I'd like to put a shout out to a project from within our wider team, STARS, sharing tools and artifacts for reproducible simulations in healthcare. This is a project trying to ensure that models that get out there are easy to reproduce. There are best practice examples in Python and R, template repositories to get you started, and a list of the things that are recommended and highly recommended or essential and recommended for every single simulation model, and hopefully that will start to see more adoption over time. So I hope I have given you an idea of why you might want to use pathway discrete event simulation for your pathway problems. I think it's a really good time to get started. I may be biased, but we've got a lot of resources that we hope we can help you with, and we know that there is more and more expertise across the community in this. FOSS libraries do allow us to adapt and reuse models, but do follow guidance to try and make it as easy as possible for people to stand on your shoulders. Thank you.
Thank you. There isn't much time for questions. There were questions, but your colleague was answering them. But I just wanted to shout out that site that you shared, that Dan also shared online, is a Quarto website. So all the Quarto. Thank you so much. Yes. Sorry, can't do the questions.
No,
I
that's
think,
great.
'cause
I will answer on Slack and
keeping
let you
people
get to
away
your
from
coffee. So-
Thank you so much. Do another round anyway, I think. Thank you. That's for Dan as well for answering. Ooh, oh, I'm pressing a button. So it's coffee time now. Coming back at 11:15 for some more talks, or if it's unconference, please go out of the room and then around. And I've lost my keep going in and out. Yeah, over there. For those online, over there. Thank you very much.